All right. Hello, everyone. Welcome to the IHSS Caregiver Education. Today we'll be talking about diabetes management. I am Rachel.
And I'm Connie.
And today, on behalf of our group, we will be presenting diabetes management. The slides were created by Crystal Kadang, Connie Dow, Rachel Jacob, Chris Kwong, Alexis Rude, and Nick Young. And we also have a Spanish version translated by Nancy Mendez and Brian Salazar. And we are all UCI nursing students. And these are some of the groups we would like to acknowledge and thank for making this presentation possible, including our professor, Jung-Ah. So today we'll be discussing introduction to diabetes, blood glucose monitoring, nutritional guidelines and physical activity, and foot and oral care.
Okay, so just to start off a little bit about what diabetes is, it's important to understand that it's a disease that occurs when your body is unable to regulate levels of blood glucose properly. And your blood glucose, aka your blood sugar, comes from the food you eat and your body's main source of energy. So that apple or donut you're eating is eventually going to be used for energy. Insulin, a hormone in your body, acts like a key to move the glucose from the bloodstream into your cells. When our body doesn't produce enough, have enough insulin, our body becomes overloaded with glucose, so this could lead to complications.
And here are some diabetes statistics. 34.2 million US adults have diabetes, and 1 out of 5 are unaware of the condition. It is the 7th most leading cause of death in the US, and it's also the #1 cause of kidney failure, lower limb amputations, and adult blindness. Seeing these statistics just makes it even more important to know how to manage and care for your diabetes.
So there's different types of diabetes, and the first one we're going to talk about is type 1 diabetes. And this is an autoimmune disease in which the body stops producing its own insulin. It's generally diagnosed in a younger crowd, such as children, teens, or young adults. Symptoms often develop quickly, and there's no prevention measures currently. Type 1 diabetes only makes up about 5 to 10% of diabetes cases.
Moving on to type 2 diabetes. Type 2 diabetes make up 90 to 95% of diabetic cases, mainly in older adults, but still can be seen in younger people. It is a disease in which the body no longer makes insulin effectively, and symptoms develop gradually, which is why this diabetes can go unnoticed. Some ways to prevent or manage type 2 diabetes are to incorporate healthy lifestyle changes.
Okay, so the next one that we're going to talk about is called gestational diabetes. This one would occur in pregnant women who, even if they've never had diabetes before, they can get this. After giving birth, gestational diabetes goes away. However, there's a greater risk for the baby to develop type 2 diabetes and become obese. So knowing how to manage gestational diabetes is something that expecting mothers should consider as well.
So the following slide are some type 2 diabetic risk factors. So one of the factors is being pre-diabetic. The following are test results of how if you are susceptible to diabetes, if you're overweight, if your BMI is 25 to 30, and if you are 45 years old and older.
And some additional risk factors is that if your family has type 2 diabetes as well, if you're not physically active less than 3 times a week, or as mentioned earlier, if you had you can have gestational diabetes when you're pregnant. And these are just some prevalence rates of people in the US diagnosed with diabetes. And it should be noted that the highest group right now is at 15.9%, and those are Native Americans and Alaskan Natives.
So this following slide has an infographic. So here's some symptoms. If you're always tired, you have frequent urination, sudden weight loss, wounds that won't heal, sexual problems, always hungry, blurry visions, numb or tingling hands or feet, always thirsty, and for ladies, vaginal infections. It's important to pay attention to the always in these symptoms because, for example, you may feel tired, hungry, or thirsty, which is normal, but you feel that you're more tired or more frequently tired, hungry, or thirsty, that's when it may be concerning. Another thing to note is that it may look different for everyone who has diabetes. For example, you may feel some symptoms more than others. You know your body best, so you have a best idea of what is normal or not.
Okay, and these are just a list of some possible diabetes complications that may occur. So such as heart disease, stroke, kidney disease, sexual problems, UTIs, nerve damage, hearing and vision problems, and circulation problems such as slow injury healing, foot ulcers, and oral problems. Okay, and now we're going to be talking a little bit about blood glucose monitoring. So we did include a video here for you guys to watch, and you guys can check that out when the slides are released later. But for now, we're just going to walk through it with you guys really quickly. So equipment, some things to gather is a glucometer, a lancet, which is used to prick your finger, test strips, alcohol swabs to sanitize, and gloves. So first thing you want to do is wash your hands and put on the gloves. Next, you want to clean the site of where you're going to be pricking your finger with an alcohol pad and then let it dry. Then you're going to set it up by inserting the test strip into the glucometer, and you're going to use the lancet to actually prick your finger. And then you're going to bring the test strip to come in contact with the blood droplet. And then from there, you can observe and do what you need to do with it. Oh. Okay, and just some notes about this is that you shouldn't milk the site. So that just means that you shouldn't squeeze it because it could alter your results. And you should ensure that the site of where you get your blood sample is not an injured area as well. And just to get the blood flow going, you should exercise or massage your hand beforehand to make it easier to obtain.
So after getting the blood out, what are some target levels you should expect? So before a meal, you want it to be 80 to 130 milligrams per deciliter. And 2 hours after the start of meal, you want it to be less than 180 milligrams per deciliter. However, blood sugar targets may be different depending on the age, other health problems you may have, and other factors. Discuss with your health provider to determine what range is appropriate for you.
Okay, and so when you do get your blood sugar levels, there's two things that should be noted. You can either be hypoglycemic or hyperglycemic. So first we're going to talk about hypoglycemia, and that's when your blood glucose level is below 70 milligrams per deciliter or 3.9 millimoles per liter. And some early signs or symptoms for that could be shakiness, dizziness, sweating, hunger, fast heartbeat, confusion, irritability, or anxiety. And some things that can develop later on could be clumsiness, jerky movements, inability to eat or drink, muscle weakness, difficulty speaking, or blurred vision. And some ways to treat that is that you can eat sugars or sweets to just kind of maintain those levels, like such as hard candy, fruit juice, or soda, and not diet soda.
On the other hand, there's going to be hyperglycemia. So the blood glucose levels above 180 milligrams per deciliter or 10 millimoles per liter. And some early signs and symptoms include frequent urination, increased thirst, blurred vision, fatigue, and headaches. And some later signs and symptoms would be fruit-smelling breath, nausea, vomiting, shortness of breath, dry mouth, weakness, and confusion. And typically how you would want to treat it is have regular exercise and take your medication as prescribed. If you notice that you take your meds and your glucose is still high, it could be that the effect did not take place yet. Medication takes time to work, so please be patient when taking glucose levels.
Okay, so first we're going to be talking about some nutritional guidelines and physical activity to be managing your diabetes. So just some tips. It should be noted that not all calories are created equal. You should choose nutrient-dense food from all food groups in recommended amounts. And like they say, you should be eating the rainbow. So some things you can do is try the plate method. So what you would do is that you would grab a 9-inch plate, and like noted in the picture, half of it's going to be non-starchy vegetables, such as salad, green beans, broccoli, cauliflower, cabbage, or carrots. And then a quarter of it is going to be lean protein. And that's going to consist of like chicken, turkey, beans, tofu, or eggs. And then the last quarter is going to be with grain or starchy foods such as potatoes, rice, or pasta. So there's 3 different types of carbohydrates that we're going to talk about. So the first one is going to be sugar. And sugar can either come from natural sources such as fruit or milk, or it can be added sugars such as what's in soda or processed foods. In general, for sugars, you want to limit the intake on added sugars. And then we have starches. And starches it includes wheat, oats, grains, and vegetables like beans or potatoes. And lastly, we have fibers, which are a part of plants that are indigestible but help with bowel movements and constipation. So in addition, fiber helps to control blood sugar levels by slowing sugar absorption. Whereas sugars and starches raise blood sugar, fiber does not raise blood sugar. And then below is just like the recommended amount for fibers for adults based on their age and sex as well. Okay, so now a little bit about carbohydrate intake. So what you consume daily, you should aim for half of your calories to be carbohydrates. So let's say you eat 2,000 calories a day, about 1,000 of those calories or 200 grams should be carbohydrates. And you should also try to spread out your carbs throughout the day and eat relatively the same amount of carbs in each meal to keep blood sugar levels steady. Something you should keep in mind is the idea of simple and complex carbs. So simple carbs such as fruit and pastas will spike your blood sugars up quickly, while complex carbs will increase blood sugar more slowly. And this could include vegetables and beans. So we should try to limit our intake of simple carbs and consume more complex carbs to help control blood sugar levels. Okay, and we'll be talking about glycemic index, or GI for short. So not all carbs are the same. Some foods called high glycemic index or GI foods can spike blood sugar levels quickly, whereas low GI foods can increase blood sugar slowly. The GI only applies to foods with carbohydrates, not really other food groups. And high GI, such as processed foods, potatoes, and watermelons, can increase blood sugar quickly. Therefore, high GI foods should be eaten in moderation and ideally with low GI foods to balance glucose levels. Moderate GI foods include pita bread, brown rice, and raisins. Low GI includes carrots, oatmeals, apples, oranges, high fiber cereal, and quinoa. A general idea to keep in mind is that foods with fat and fiber are often low GI food. You would want to prioritize eating low and moderate GI food to control blood sugar levels. Okay, and a little bit about reading labels, which is important to help keep track of this. So with serving sizes noted in number 1, that's going to tell you how much these labels are based off of, but that's not how much is in a container. On the top where number 2 is, that's how much is in a container, and in this case, it's 8 servings, so you would multiply the whole thing to get the total of what's inside the container. And at number 3 is where you can find the total carbohydrates, and it is broken down. So you can see the dietary fibers, total sugars, and added sugars as well. You can also find additional info like vitamins, minerals, proteins as well. And it's just something important to note. And also you should be limiting your sodium and added sugars and avoid trans fat. Okay. And additionally to your nutrition, it's important to be staying active as well. So it's recommended to have around 150 minutes of moderate exercise per week, and this can be spread out how you want to. So for example, you can do 50 minutes 3 times a week, you can do 25 minutes 6 times a week, or 30 minutes 5 times a week. And moderate exercise could be things like a brisk walk, it could be lifting weights, working with resistance bands. You can also do hobbies like heavy gardening, which involves digging or shoveling, or yoga. And it's a good idea to do muscle strengthening activities as well to work all the major muscle groups. Okay, and some benefits to physical activity is that this could improve your response to insulin, which in turn lowers blood glucose levels and reduce risk of developing diabetes complications. It can also help to control weight and to lower blood pressure and cholesterol levels, and also releases endorphins, which will improve your mood and help you feel happier, and it'll help you get better sleep as well.
All Alrighty, so we're moving on to the last section of our presentation, and it's foot and oral care. So having diabetes can increase the risk of having foot injuries due to poor circulation, which can cause slow healing time, and nerve damage, which can take away feeling in your feet. This can lead to patients not noticing any foreign objects in their shoe, which can lead to developing a blister/sore, and possibly ending in an infection and or a non-healing wound that could put one at risk for infection or even amputation. Due to nerve damage caused by diabetes, peripheral neuropathy is a condition to especially look out for in your feet due to tingling, pain, and numbness. Having this condition can affect mobility and increase fall risk. So we'll be next talking about foot care, and as a disclaimer, please do not treat these issues on your own. If you have any of the following conditions, please talk to your primary health provider for proper evaluation and treatment. So in the infographic below, some common type diabetic foot problems can include bunions, callus, ingrown toenail, dryness, and ulcers, but this is not the whole comprehensive list. The upcoming content may be disturbing to some viewers, so viewer discretion is advised. So according to the Wagner classification of diabetic foot ulcers, we can see different types of foot ulcers that range from grade 0 to grade 5. So we can see at stage 0, it's intact skin, but it's high risk. At grade 1, we can start to see a superficial ulcer. At grade 2, it starts to become deeper with no bony involvement or abscess or a pocket of pus yet. Grade 3, we start to see the abscess, so again, a pocket of pus with some bony involvement. Grade 4, we start to see localized gangrene, which is basically tissue death caused by lack of blood, and that can be at the toe or heel. And at grade 5, we start to see extensive gangrene of the foot with necrotic lesions starting to spread on the foot. So we're going to go ahead and talk about some tips for healthy feet, and this is all from the CDC guideline. So check your feet every day. This can be for cuts, redness, swelling, sores, blisters, corn, or calluses, or any other change to the skin or nails. You should use a mirror if you can't see the bottom of your feet, or have a family member help. You should wash your feet. This would be under warm water, and you should dry your feet completely and apply lotion to the top and bottom to avoid dryness, but not between your toes, which can lead to infection. You want to never go barefoot. You want to wear shoes that fit well and socks or slippers, even inside, to avoid injury, and check that there are any objects inside your shoe and the lining is smooth. You want to trim your toenails straight across so that way you have a less of a chance of having ingrown toenails. And don't remove corns or calluses by yourself, as it increases your chance of harming yourself in the process. More tips: you want to get your feet checked at every healthcare visit. If you need it, visit your foot doctor every year, more often if you have nerve damage, for a complete exam, which will include checking for feeling and blood flow to your feet. And you want to keep your blood flowing. Put your feet up when you're sitting and wiggle your toes for a few minutes several times throughout the day. And diabetic socks can help with that. Choosing feet-friendly activities. This can be walking, riding a bike, or swimming. Check with your doctor about which activities are best for you and any that you should avoid. So be sure to ask your doctor what else you can do to keep your feet healthy. And then this slide is just a comprehensive summary of what we just discussed. So going through it quickly is wash your feet daily with lukewarm water, dry your feet well, applying moisturizing lotion, check your feet for blisters or cuts, redness, etc. Cut your toenails straight across to avoid ingrown toenails. Change your socks daily. Never walk barefoot, and examine your shoes daily for cracks. All right, so now we're going to move on to the next portion. We're going to talk about oral care. So like foot care, diabetics are at higher risk for oral problems. The high glucose in the saliva can promote bacteria and plaque, which can lead to tooth and gum disease. Some common oral problems are gingivitis, which is an early stage of gum disease that involves redness, inflammation, and bleeding, and periodontitis, which is a serious disease of gum and bones that support teeth. So to further illustrate oral care, we have two graphics, the cartoon on top and then the real life example. So we can see on the left-hand side, we can see the healthy tooth and the healthy gums. And as you progress to the right side, you start to see gingivitis, again, like with the inflamed gums. And you can start to see some calculus, which is built up plaque on the teeth. And as you move forward, you start to see periodontitis, more inflamed gums, and you start to see some pockets as the bone that supports the tooth starts to decay. And on the advanced periodontitis, you just see the extreme version of the pockets, the inflamed gums, and the calculus. And periodontal disease can result in the loss of some or all teeth in people with diabetes. People without teeth can suffer emotionally and nutritionally because they may not be able to eat many important types of food. Every attempt should be made to replace missing teeth with dental prosthetics when there is significant loss of chewing function. Periodontitis can negatively affect diabetes control and development of diabetes complications. The infection and inflammation associated with periodontitis can aggravate blood glucose control and increase risk for many of the complications of diabetes, such as the cardiovascular disease and the chronic kidney disease. So here are more common oral problems. So first, we're going to see thrush. So people with diabetes who frequently take antibiotics to fight various infections are more likely to develop a fungal infection of the mouth and tongue, or thrush. Thrush thrives on high glucose level in the saliva of people with uncontrolled diabetes. And wearing dentures can also lead to the fungal infection. And as you can see in the picture, you can see sore whites and red patches. Next is the mouth ulcers or canker sores. These are small sores that can interfere with drinking or eating and talking. This can be caused by having minor injuries such as biting your cheek, and is a very common occurrence that one should not be too concerned about, and it's the right hand with a little circle on it. Next is cavities. So when sugar and fiber come in contact with the bacteria in your mouth, plaque forms on your teeth. The acids in plaque attack the surface of your teeth, which is your enamel, and this could lead to small holes on the tooth. The higher your blood sugar, the greater supply of sugar and starches, the more acid that's wearing away your teeth. And you can see on the left-hand side of the canker sore image, there's a little hole on the tooth. And lastly, if you have dry mouth with diabetes, it can decrease saliva and increase the risk of tooth decay and gum disease. And you can see as a tongue, the dry tongue up there. So lastly, here are some prevention tips to help with your oral care. So regularly visiting your dentist and having cleaning twice a year. Telling your dentist about your diabetes. Telling your dentist can help you have a personalized care plan for your oral. Brushing your teeth at least twice a day, and flossing at least once a day to reduce that plaque buildup. You can use fluoride and anti-plaque rinses, gels, or toothpaste. Having a good control of blood glucose levels, as you can see from previous examples, having high sugar can also increase your likelihood of having cavities and whatnot. And having a healthy diet and avoid smoking. So that concludes our presentation. Thank you so much for watching. If you have any questions, email to Jung-Ah l@uci.edu. Again, it's jungahl@uci.edu. We thank you so much for watching and have a great day.
Thank you.